Hello, this is Dr. Gay from First Sec MRI, and this is a 58-year-old female who injured her hand about 6 months ago, kind of a hyperextension type injury. She's having pain in the region of her fourth finger. They thought there maybe was a trigger finger. And so this is an axial T1 view where we can see the thumb over here, second, third, fourth, fifth metacarpal bones here. All these areas that are gray are the muscles of the hand. We see the extensor tendons along the back surface of the hand here. Some of them blend together. They're a connection, so instead of seeing like one clean tendon, we see these kind of curious areas that are bonded together. But as we go more distally into the fingers, they separate out, and we have one for the third. There's a third extensor tendon. Here's a second extensor tendon. They're very small, and sometimes they're hard to see in these axial images. Now, the flexor tendons are down here on the palmar side. This is the palm. We see flexor tendon of the thumb, flexor pollicis, and we see two tendons of the other one. So a profundus and superficialis, two tendons. And on this patient, we say, hey, these look pretty good. This fifth one, a lot of times, sometimes it can be a single fifth one, or sometimes they're just so small, they look like they're one, but at least here we almost always see distinct superficialis and profundus. And now we're going to follow this up to the fourth digit. So as we go to the fourth digit, we see the flexor tendons that all look like they're intact, but we see a problem on this view. So we're into the fourth digit, and we notice that the flexor tendon, instead of hugging the bone, there's a gap here between that. And so we can see that this is elevated. If we look at the fifth one, it hugs the bone. Third one, it hugs the bone. And there's something called the Pulley mechanism. It forms a pulley around it, a sheath, and it holds the flexor tendon adherent close to the bone. And this pulley is torn, and there's several pulleys, 5 pulleys in each finger. So what we call the A1 and A2 pulleys are torn. I'll show you in a sagittal view what this looks like, but here it shows best. Hugging the bone, away from the bone. And this is a sagittal view now. We can see the hand in profile. We see the flexor tendon here, and then this is the finger. This is the third finger. We see the flexor tendon is hugging the bone. This is the first metacarpal head. Here's the proximal phalanx, and we can see it's hugging the bone there. And now we'll slide over to the other one again, a nice close association between the bones and the flexor tendon. And we're going to go to the fourth flexor tendon, and we say, whoa, this is very different. We see the flexor tendon here. There's a gap, a significant gap between the proximal phalanx. Here's the fourth metacarpal head. We see this big distance between. There's fluid in between, so this is a tear of the pulley that holds us close together. And the A1 pulley is around right here, so it looks like it must be torn because this is drifted up so far. And the A2 pulleys in this area over here, and we can see that big gap, so there's a tear of the A1 and A2 pulleys. Then we get up here to the proximal interphalangeal joint. We see it start to hug the bone again, so this one is okay. So we have a tear of the 2 proximal pulleys, A1, A2 pulleys, allowing the flexor tendon to drift upwards. We have that complex fluid underneath it. And just one last look at this. This is an axial image where fluid is bright. This is that fourth flexor tendon. This is the bone. Again, it should be touching the bone or very close to it. And instead, we see a little blip of water in between there, a fluid signal. So a pulley mechanism injury. You actually see where the pulley is over here. Let me zoom this on up here. We see this little black line going around that may be the pulley that holds this in place. And over here, the pulley is torn. Maybe this is a little piece of it right here. Instead of enveloping this, it's hanging out here, and there's just fluid here instead. And that's it. So pulley mechanism injury of the fourth finger, and maybe a little subtle one of the fifth as well. Thank you so much.